This school year, all VI public school students will learn from home, at least until January. That means you should be properly groomed each morning. Put on your uniform shirt and a skirt or pants that reaches to your knees. Sit at your desk or a table with your back against the wall and turn on your computer and camera before class begins. Your teacher and your classmates can see you now. If you don't have a computer, you will still learn with your class. But every student will receive his or her very own Chromebook soon. Learning from home is still learning. Let's do it.
I'm Kimberley Causey-Gomez, the Commissioner for the Virgin Islands Department of Human Services. This is a PEBT issuance deadline alert to all parents and guardians of children who attended schools that participated in the federally funded school lunch program. The deadline for issuance of benefits for the 2019-2020 school year is this Monday, September 28, 2020. If your child did not receive a card, or if your child or children's benefits were not loaded onto your current SNAP card, please immediately contact the PEBT hotline at 340-772-7120 or email pebt@dhs.vi.gov. While the SNAP office will continue to work to resolve issues for students who have been issued a card, no new issuance for the 2019-2020 school year can be made after this Monday, September 28th. If you have been contacted to come to the SNAP office to pick up your child's or children's cards, we urge you to come to the SNAP office and claim your benefits. Please do not throw away your cards. Additional PEBT benefits are being approved by our federal government and will soon be announced. These benefits will be loaded on that same card once your child is deemed eligible. Keep your card in a very safe place like you do your own bank card. If you received your card or cards, please immediately follow the steps to create a PIN, even if you do not plan to use the benefits right away. If you're experiencing problems pinning the card, please call the 1-866 number on the back of the card or contact the PEBT hotline at 340-772-7120.
Good day. Welcome to our weekly Government House press briefing and COVID-19 update for the week of September 28th. I'm Richard Motta, Communications Director for the Office of the Governor. We have this week with us the Director of the Division of Personnel, Ms. Dana Clendenin, here to provide information on Medicare Advantage for government employees over the age of 65. We also have Commissioner of the Department of Human Services, Kimberley Causey-Gomez, to provide a much anticipated update on the second issuance of PEBT benefits, and also Territorial Epidemiologist Dr. Esther Ellis, who will provide the COVID-19 statistics today on behalf of Commissioner of Health, Justa Encarnacion. But before we begin, I want to start this afternoon with a solemn note, providing some words on behalf of the Governor on the passing of a very well-known member of our community, Mr. Wayne Faxman Adams. I want to extend condolences to his family, friends, and all in the Virgin Islands community who are mourning his loss. Governor Bryan, upon learning of his passing, said Sunday, Wayne had a gift that he selflessly shared with our community. His penchant for information and his love for Virgin Islands history made him a household name and an icon on our local talk radio shows, where he would frequently call in to tell of the achievements of Virgin Islanders. He was an important voice, and he will be sorely missed. So those were the words from Governor Bryan this weekend in remembrance of Wayne Faxman Adams. May he rest in peace. Now we will go to Dr. Esther Ellis for our COVID update for this week. Dr. Ellis?
Good afternoon. As of September 28, 2020, the Department of Health has reported that we have tested a total of 20,167 individuals. 1,317 of these have tested positive, and 18,836 have tested negative. There are currently 81 active cases in the territory. 1,216 cases have recovered, and there have been 20 fatalities related to COVID-19. From the hospitals at JFL, there are 0 COVID cases. At RLS, there are 4 COVID cases, one of which is vented. Based on recent epidemiology reports, we have continued to test, and so have private providers and labs across the territory. All providers that conduct COVID testing report their testing results to the Department of Health. We have recently seen a small spike in positive cases on St. Croix, with 43 of the active cases on St. Croix. Close contact is currently still the highest mode of transmission, but community spread is still a concern. To ensure that transmission remains low, we need to be cautious. Although we are open for leisure travel, there are still restrictions in place to keep residents safe and visitors safe. Last week, we discussed some of the guidelines restaurant patrons should follow to stay safe. I will share that information again. Restaurants are now offering dine-in services, but you must follow the proper safety precautions. Although restaurants with bars are able to serve drinks, there is no ordering of drinks or drinking at the bar. Patrons must always wear a mask when entering the establishment, when ordering food and drinks, and when using the restroom, for example. The only time your mask should be removed in a restaurant is when you are eating or drinking. Some restaurants are exempt from the glass and silverware restrictions. Any restaurant exempt from this order should have an exemption sign posted. A list of exempt restaurants can be found at doh.vi.gov. With travelers pouring into the territory, it is critical that basic precautionary measures are taken by residents and visitors alike. Frequent hand washing, good respiratory hygiene, social distancing, and the proper use of masks can keep us all safe. We have been fielding inquiries regarding travel, so I will cover some frequently asked topics regarding travel to the USVI. Since September 19, 2020, all travelers to the U.S. Virgin Islands aged 5 or older have been required to take a COVID antigen or PCR test within 5 days of travel or an antibody test within 4 months. Travelers must produce either a negative COVID-19 antigen or PCR test result from a test taken within 5 days prior to the travel or a positive antibody test result taken within 4 months prior to travel to USVI. Every traveler aged 5 and older must use the travel portal, USVItravelportal.com, before travel. Children 4 or younger are exempt from this testing requirement. It is critical that testing is conducted before arriving in the Virgin Islands, as the safety of residents and visitors to the territory is our highest priority. There is a 5-day window to take a test prior to travel. The availability of tests varies from location to location, so prospective travelers who are required to present test results are encouraged to plan their testing to meet that requirement prior to traveling. Test results from a test taken outside of the 5-day window do not meet the requirements. If for some reason travelers are unable to produce the required test results, they will be subject to quarantine for 14 days or until they are able to receive the required test result while in the territory. Travelers are not encouraged to take a test upon arrival unless it is a dire situation. We have started a pilot COVID-19 testing project at both the Cyril E. King and Henry E. Rolson airports. This project allows for surveillance and data collection at the airports and will continue until we have chosen a company to complete full-scale testing. In the past week, we have tested 110 individuals at the airports that arrived without a COVID result. And as previously mentioned, we identified one positive case. It is important that you comply with our requirements and test ahead of your travel date to avoid traveling while infected by COVID-19. In the past week, we continued to engage our community through various outreach activities. On St. Croix, we played COVID-19 messages via loudspeaker in neighborhoods including estates Clifton Hill, Prosperity, Little LaGrange, Humbug, Tamarind, Diamond, Paradise, Scion Farm, and other areas. We also distributed masks on the boardwalk in Christiansted, Plaza Extra West, and to some faith-based organizations and schools. On St. Thomas, we distributed masks and flyers to the community in Charlotte Amalie. Red Hook, Plaza Extra, Food Center, the Frenchtown Fish Market. On St. John, we distributed masks and flyers to restaurant shop owners, faith-based organizations, and the community outside of Starfish Market. Today, we are conducting free testing on Water Island and to the surrounding marine community. Our goal is to educate the public, provide them with the tools they need to protect themselves, and ultimately slow the spread of COVID-19 in the territory. In the past week, we distributed 24,671 masks, 4,793 educational flyers to the community, and we have also partnered with Island Therapy Solutions, and they have joined our outreach efforts by providing information on crisis counseling to residents. The Department of Health's outreach team has worked day and night to connect with our community, and I would like to send a heartfelt thank you to them for their dedication and commitment to our islands. We continue to educate residents on how to properly wear a mask as we distribute disposable and reusable masks. Wearing a mask properly, covering both your nose and mouth, is essential to staying safe. Masks provide an extra layer to prevent respiratory droplets from traveling into the air and onto other people. Masks are required to enter all establishments in the territory, but that's not the only time you should wear a mask. You should always wear a mask when you are outside of your home if around people you do not live with in close proximity. This goes for friends and coworkers too. If you cannot maintain physical distance, it is especially important to wear a mask. Increased testing capacity is important, but proper mask wearing is even more critical. It's critical that if you know you've been exposed to the virus or suspect you've been exposed, that you quarantine and stay home. You must be responsible as an individual. We need to all do our part to keep our community healthy. If you are experiencing fever, chills, muscle aches, a cough, loss of taste or smell, or have any symptoms at all, please call the Department of Health's Epidemiology Division at 340-712-6299 or 340-776-1519. If you feel sick, stay home. If you get tested, please remember you are required to quarantine and stay home until you receive a negative test result or are cleared to be discharged from quarantine. The deadline for Census 2020 is approaching, and I would like to encourage you to participate. Your responses help the census, and it helps our community too. Your participation counts. The census count has implications for public health, such as funding, as programs depend on accurate enumeration. Hospitals, healthcare clinics, and healthcare programs such as Medicaid, the need-based health insurance program for low income, and Medicare for people over age 65 are among the many public healthcare services that use population statistics from the U.S. Census Bureau. Call 340-718-2020 and complete your census application over the phone. Again, to call to complete your census over the phone, the number is 340-718-2020. The Department of Health continues to regularly update the numbers of persons under investigation and report any confirmed cases. These official reports can be found on the U.S. Virgin Islands Department of Health Facebook page or website, www.covid19usvi.com. For COVID-19 health information alerts, text COVID-19 USVI to 888-777. Thank you, and let's all work together to stay safe and healthy.
Thank you, Dr. Ellis. Now we will hear an update from Director Clendenin on the Medicaid Advantage for government retirees.
Good afternoon to the listening and viewing audience. Again, I'm Dana Clendenin, Director, Division of Personnel. I'm so pleased to join the Director of Communications, Mr. Richard Motta, on today's press briefing. As previously mentioned, I have some exciting news for government retirees over the age of 65 and their dependents. Beginning January 1, 2021, the government of the Virgin Islands will roll out a new Medicare Advantage plan for government retirees who are over the age of 65. This means that the more than 6,000 retirees within the territory who are over the age of 65 will now be part of the more than 1.3 million group Medicare Advantage members. As this is monumental for the territory, I do want to take this opportunity to thank the Honorable Governor Bryan and the Honorable Lieutenant Governor Roach, United Healthcare, the Division of Personnel, and the GESC Board on this significant accomplishment. Additionally, we could not have done this without our partners at VI EquiCare, the Schneider Regional Medical Center, and the Wong Louis Hospital. So what does this mean for our retirees? Well, here are some of the benefits. 0 copay on all your doctor visits. I'll say that again. 0 copay on all your doctor visits. 0 deductible. You get the much asked for and anticipated $500 allowance for vision and hearing aid exams. You get free virtual consultations with nurses 24 hours a day, 7 days a week. There's free access to fitness centers or the gym. You get gift reward cards for house calls, such as a virtual preventative checkup. And yes, Part D prescription drug coverage remains the same. What's more, the best part is there's no additional cost in premiums for those post-retirees of 65 on Plan F. I'll say that again. There's no additional cost in premiums for retirees over 65 on Plan F. This plan has a 98% satisfaction rate with the freedom of nationwide access for in-network coverage. So if you're in the territory, you see the best doctors here. If you're on the mainland, you see the best doctors there. And then you just have one card for all your medical needs. No confusion and no need to carry a Medicare card or a health insurance card. So to learn more about the Medicare Advantage plan being offered, United Healthcare will be hosting a virtual webinar beginning October 19th to the 23rd, 2020, from 10 a.m. to 12 noon, and again from 2 p.m. to 4 p.m. If you're not able to join the webinar via a web browser, you may also dial in by phone to listen and ask questions. As of today, September 28, United Healthcare began mailing out notifications via postal mail with specific instructions on accessing the webinar. If you have not received communication by October 12th, please contact the Division of Personnel at 340-774-8588 or 340-718-8588 to ensure that your mailing address is current. You also have the option, if you decide not to participate in this fantastic plan, you have the option to opt out until November 10th, 2020. And again, you'll contact my office, Division of Personnel, to do that. I thank you for your time. Stay masked, sanitized, and be safe.
Thank you, Director Clendenin. That certainly is some very exciting news, and I'm sure very welcome news for our government retirees over the age of 65, many of whom live on a fixed income, and healthcare costs are probably one of their most expensive expenditures. But before we go to the Commissioner of Department of Human Services for the PEBT update, I have an update on the unemployment numbers. So I'll go ahead and provide that at this point. As of this morning, the Virgin Islands Department of Labor has issued 39,763 unemployment insurance checks, totaling just over $30 million to Virgin Islands residents impacted by COVID-19 related job losses. The Virgin Islands Department of Labor has also issued an additional 27,356 federal pandemic unemployment compensation payments, totaling just under $42 million, and continue to make progress on the Pandemic Unemployment Assistance Program for Self-Employed Individuals, also known as PUA, and the Pandemic Emergency Unemployment Compensation Program, which we refer to as the PEUC. And that program extends the unemployment benefits for residents who currently are getting COVID-19 related unemployment insurance. Vital has issued $4.1 million in PUA and $1.3 million in PEUC. So that means to date, the Bryan Roach administration has issued a total of 69,717 unemployment benefit payments to Virgin Islands residents, totaling just under $78 million, and that's up $1.5 million since last Monday's update. So we will now go to the Commissioner of the Department of Human Services for an update on pandemic EBT.
Thank you, Director Motta. And the visiting and listening and viewing audience, I'm really excited to be here today because we have some good news for you. The Department of Human Services is pleased to announce the approval of our application for a second round of PEBT food assistance for August and September of the 2020-2021 school year. Before jumping into the details of what we are calling PEBT2, I would like to remind the public of a few critical items regarding the first issuance, or what we are calling PEBT1. As announced last week, the deadline for issuance of benefits for the 2019-2020 school year is today, Monday, September 28th. To further help people having trouble pinning their cards, and to assist those who have been asked to come to the office to claim PEBT cards and that were returned to us in the mail, the call center and issuance staff will remain available to the public until 8 p.m. tonight. Please take note of the following. If your child did not receive a card, or if all of your children's benefits were not loaded onto your current SNAP card, please immediately call the PEBT hotline at 340-772-7120, or email us at pebt@dhs.vi.gov. While the SNAP office will continue to resolve all of the issues, no new issuances for the 2019-2020 school year can be made after today, Monday, September 28th. If you're coming to the office to pick up your card, you must bring the following. Please bring your picture ID for your parent or guardian, your child's birth certificate and social security card, and your proof of mailing address. I also want to take a moment to personally thank all of you that have returned a card or cards that were mailed to you to your address in error. Thank you for being an example of what it really means to be trustworthy and contributing to our community member. Now let's discuss what happened Friday on our announcement for the second round of PEBT food assistance for August and September. The total amount of this issuance benefit to the territory is an additional $1.5 million, or $1,513,308.96. This benefit is to help families supplement the nutritional needs of their children due to the pandemic school closure. The benefit amounts that will be issued will vary by school and is based on the number of school days with virtual instruction. Students attending schools that have had or in-person instruction will not receive PEBT based on the guidelines provided by the federal government. Now, as a reminder, PEBT is not disaster SNAP or DSNAP. The territory is not declared as a disaster, and therefore the implementation of DSNAP has not been approved by the federal government. Now, who will receive the PEBT and how will they receive it? Each kindergarten or K through 5 through 12th grade currently enrolled in the USVI public schools and private schools that participate in the school lunch program. Existing eligible SNAP clients' PEBT benefits will be applied to their current SNAP card by Wednesday, September 30th. Existing PEBT recipients will have the second round of benefits added to their current card. Now, for new eligible non-SNAP clients, cards will be mailed to the addresses provided by parents or guardians to the respective schools. Therefore, those households should have received their cards in the mail within the next 2 weeks. There is no application process. The Virgin Islands Department of Education and eligible private schools provided Human Services the names of students based on their communication to families and their school-based requirements enrolled for this school year, 2020 and 2021 school. Now, for eligible students who do not currently receive SNAP but were issued a card for PEBT-1, the benefits will be automatically loaded onto your card, so please do not throw away your cards. For eligible students who currently receive SNAP, their benefits will automatically be loaded onto your existing PEBT card. PEBT benefits can be used for food purchases only at authorized SNAP retailers. The benefits are not transferable, and you must destroy the card if you do not want the benefits. Now, for new students, the card will be issued in the student's name. Households with more than one eligible student will receive multiple cards, one for each child. For eligible new students who do not currently receive SNAP, the cards will be mailed to the household based on the address that you provided as a parent or guardian to the school. Instructions will be provided on how to set up and utilize the card to access the benefits. Make sure you read the instructions. Eligible new students who currently receive SNAP will have their benefits loaded onto their household's existing EBT card. Now, the following are schools that are eligible for the PEBT-2, and please note that each child is receiving an amount per child based on the calculation not by the Virgin Islands government, by the federal government at $6.84 per child per eligible day. That differs for each school. The number of eligible virtual school days in August and September of 2020 for school year 2020 and 2021, so specific amounts are different for each school. The following schools will be receiving the benefits for PEBT-2: Department of Education, Church of God School, Free Will Baptist School, Reading Rainbow, St. John Christian Academy, All Saints Catholic School, Bethel Baptist Day School, Calvary Christian Academy, Faith Alive Christian Academy, Moravian School in St. Thomas, New Testament Academy, Saints Peter and Paul Catholic School, Tutu Church of God Holiness, Wesleyan Academy, St. Patrick's Catholic, and St. Mary's Catholic School. St. Joseph's School and St. Croix Christian Academy will not receive PEBT benefits for this second round, so please contact the school specifically for details. DHS is still awaiting federal guidance for the continued issuance of PEBT benefits after this. For more information about PEBT, please visit the website www.dhs.gov.vi. Families may also call the PEBT customer service number at 340-772-7120 or email us at pebt@dhs.vi.gov. Now remember, the call center and issuance staff will remain available to the public until 8 p.m. tonight. That's September 28th. I would like to close, Richard, by recognizing my staff across the territory who continue to work around the clock, literally, to ensure that we secure as much federal assistance as possible during this Bryan Roach administration. This is a very difficult time for our community. All DHS offices, but in this case, the SNAP office and team members have willingly worked nights and weekends to advocate, partner, move mountains, and provide assistance. While there may have been hurdles to jump over to make these benefits possible, and while the process has been long and frustrating for many of us, I know that I and my team are committed to that work. We do believe that working together, we can make a difference. Thank you.
Thank you, Commissioner. A difficult time indeed, not just for the government agencies, but many in the private sector as well. And so thank you for acknowledging your staff and the other government employees who are really going above and beyond during this time to provide the government services that the public requires. In closing this afternoon, Governor Bryan issued a statement earlier today indicating that his financial team has suspended its efforts to close on the matching fund securitization transaction that was first introduced to the public in his press conference on August 11th. While the transaction was somewhat complicated in its structure, it ultimately promised to provide a significant cash infusion to the Treasury of the Virgin Islands over the next 3 years, while simultaneously reducing the long-term debt obligations of the government by an estimated $40 million over a 20-year period. The governor has made it clear that his intentions were to use those savings to shore up the GERS pension system to the greatest extent possible and provide short-term relief as more long-term strategies were developed and effectuated. The extremely low interest rate market has made this transaction possible, and the administration has moved aggressively to seize the opportunity for the people of the Virgin Islands. The governor once again thanks those senators who provided the chance for this initiative to be explored. He remains committed to averting a cut in benefits for the current retirees of the public pension system and looks forward to continued collaboration with those senators that understand the urgency of the situation and are willing to work towards a solution. Lastly, Governor Bryan wishes to thank the dedicated police officers of the Virgin Islands Police Department for their quick resolution of the September 12th murder of 20-year-old Renisha Juanita Rivera. While nothing repairs the hurt of the untimely loss of a loved one, it is our hope that her family will at least get the justice and closure that they deserve in this matter. VIPD is demonstrating the willingness and ability to take violent criminals off the street. And with the continued cooperation of the public in providing information to law enforcement and refusing to harbor and protect dangerous criminals, we can begin to restore safety and security to our communities. That concludes our press briefing and COVID update this week. We will now take any questions that the media may have. Questions? All right, we're getting a signal that we do not have any questions. So with that, we will see you here next Monday. God bless, stay safe, and stay sanitized. Thank you.
This school year, all VI public school students will learn from home, at least until January. That means you should be properly groomed each morning. Put on your uniform shirt and a skirt or pants that reaches to your knees. Sit at your desk or a table with your back against the wall and turn on your computer and camera before class begins. Your teacher and your classmates can see you now. If you don't have a computer, you will still learn with your class. But every student will receive his or her very own Chromebook soon. Learning from home is still learning. Let's do it.